right, it's time for the big hard facts. 99.3 Nigeria Info. I did tell you that we were going to be talking about the health sector today, even as Mr. President has signed for military generals, retired ones, to get free medical checks outside of the country, $20,000 in ESTA code, and bulletproof SUVs take home. Well, let me describe in a few words what the Nigerian health sector looks like today. Nigeria's health sector is characterized by several challenges, including underdeveloped infrastructure, lacks modern medical facilities, low government budget allocation. I mean, in 2021, the federal government allocated 5% of its budget to health compared to the 15% that it pledged in 2001. There's been poor compensation. Healthcare workers in Nigeria are poorly compensated, which has led to many immigration abroad. Limited health service insurance. Health insurance services in Nigeria are limited. The most health expenses are borne by individuals and their families. The list is endless. My guest is joining me via Zoom. He has been here in the studio before, especially when we're talking about the outbreak of cholera. And he's joining us today. So happy New Year, Doc. I've not seen you this year. We've only spoken. So happy New Year. Doyin Odubanjo is a public health physician. It's so good to have you join us. He's also a scientist, just so you know, on the side. Doc, you heard me reel out some of the information and the challenges that you people face in your industry. And it's not news to us. I remember when I lived in Port Harcourt, and a friend of ours, our colleague whose father was sick, was in that hospital. We had to buy mosquito nets. That's the University of Port Harcourt Teaching Hospital. We had to buy insecticide. We had to buy Dettol. We bought down to gloves and scissors.
But you didn't buy water, did you?
Well, I don't remember if we did. But I'm saying, as friends of the family, these are the things we brought to the hospital. We even brought lamps, rechargeable lamps, just so that if the man had to use the bathroom, that's how bad. And this is a teaching hospital. I remember also when I was on air, when somebody called to say that they've had surgeries, and this was a doctor, and they had to use flashlight to complete it.
We've been there.
And we're in 2025. Let me start by asking you how you feel about the president's generosity to military generals when they retire.
It's good and bad, good because it's not an easy job, really. And if you do make it through and you survive to retirement as a general, you actually a tough job, and you survived through the skin of your teeth, as it were. So you can't quite complain. I can't quite complain about it, except for things like having to do your medical checkups abroad and all that. But I can't quite complain. Again, if you get a bulletproof SUV, you might imagine that such a person might be a target, as it were. So there are things to justify it. The only question, and I think the real problem we will all have with it mostly, is that does that apply to other people also? That in this kind of climate,
can I answer it? No.
Yes, so that's the problem I think we have, is that are we trying to be as generous to others because they are doing a great job, they deserve this and that, but many people deserve many things too, and are we thinking about them? Are we trying to do things not exactly the same, but at least things that are fair, good, nice, or whatever you want to call it for those people as well?
I asked the question earlier today because that was one of my headlines today on the Big Three. And my bigger question was that with this amount of money allotted to one person as ESTA code, underline the word foreign health or medical trips, does that in any way signify that this government or any other government is interested in building and improving the healthcare delivery that we have here right now in this country? Is there any hope whatsoever?
Yes, so I think that's the bad thing about it. Some time ago, I did watch, for instance, an interview where somebody was asking the Minister of Health what he thought about our president going abroad for medical treatment. Then they talk about, yeah, it's his private affair, is his money. He has to see his own physicians that he's been using since. But things change when you're in public office. Excuse me. Things change when you're in public office. Even if it's your money, there is an appearance you must put up for us.
Sorry about that.
Excuse me. So I think that's the issue here, which is that if you spend this much and these people have to go abroad, again, like you said, it suggests to us that there's no confidence. You yourself are already telling us that you have no confidence in the system, and you also have no confidence in fixing the system. So it's similar to budgeting billions for diesel, for generator in a government house, because that's what you've just told the public, is that anything the Minister of Power is saying about fixing the sector is a joke. Because you are already buying diesel or budgeting for diesel because you know it won't work.
Let's start with looking at the challenges that the health sector faces in Nigeria, and let's not go too far to compare. We even have our doctors migrating to neighboring South Africa here. And that's because they have maybe better medical facilities. Why has it taken so long for government to rebuild or refurbish or better the lot of the people in the medical sector? Not just the people, but even infrastructure. Like I said, how are you using touchlights? That's what we call it, flashlights, and all kinds of things in surgeries. Why do you think it's taken so long? I mean, remember, I just read out that 5% was allocated in 2021, for health. This year, I can't even remember what the percentage was. But why is it taking so long? It's 2025, and people have been going to the moon and back, and people are beginning to buy land somewhere in Mars. Why are we still here?
I think it's you're talking largely about human resources for health. What are we doing first about the human resources and the infrastructure? I think it's just a lack of political will. We don't see it for what it is. We don't think it's as important as it is. So, for instance, the human resources for health, we thought, there are hordes of people that are migrating. And by the way, when we had 2020 and COVID, and everybody was screaming, health sector, even the private sector was pumping in money. I had several conversations and interviews even where people said, the health sector is going to be much better now. Everybody realizes how important it is. And I said, no, it's going to be much worse.
Why?
I said, because they really don't understand how important it is. They're only scared for the moment. And for the moment, everything is shut down. They can't go anywhere. They're afraid for their lives. And then at that point, you saw what political will meant. Because at that point, they felt this was going to affect them terribly. So whatever was needed in that sector, equipment they were ready to buy, whatever it is, they were putting down the money. Everybody, government. I remember back then, 2014, I remember when we had the Ebola outbreak in Lagos. And the commissioner said it was an interesting time. He said, because I can never forget that comment. And he said, at that time, they would go to the executive committee meetings and nobody was arguing about anything. They were just asking, what do you want, Commissioner? He said for the first time there was no debate, nothing. They were just saying, what do you want? Because everybody was afraid. And then you saw political will in action. So again, you see political will when it affects them. But for as long as we think that we can travel abroad, when we are sick, we don't really care. We pay lip service.
So Doc, are you saying that this is deliberate on the part of our politicians? They deliberately refuse to upgrade the system because it doesn't bother them, and they have the money, our money, that takes them in their private jets to whatever country to get, their medical help, and so whatever happens to the system, they couldn't be bothered. Is that what you're saying?
I'm saying this is a sin of omission, not of commission. This is negligence. This is just, I don't really care.
Is it?
I've not really given it as much thought as you think I have, and as much as I say that I have. Because usually, again, talking to political office holders, I tell people, don't think about yourself and your ability to jump on a plane when you're sick to go abroad. I said, think about you having a stroke in your village, not in Lagos, not in Abuja, in your village. And the nearest place they will get you to is important. What those people have to attend to you with is important. Before you even get to the next town or city, to get to a general hospital, what they have in that general hospital is going to save your life. You have about 6 hours for them to determine what your future will be like. In those 6 hours, before you make it from your village to whatever city to fly internationally, you will not get anywhere in 6 hours. And yet they need those golden 6 hours to determine your future.
Wow.
So that's what I tell them. Think about that kind of situation, meaning that your health sector must be, or your health facility must be good enough to attend to you at the weekend or whatever that you decide, or Christmas and things that you decide you're going home to your village. If something were to happen to you, they better be good enough to attend to you then.
I like to, make references to presidents like Nelson Mandela, the late Nelson Mandela. He died in a hospital in South Africa. All of his treatments were in South Africa. I don't know why in Nigeria we're still very okay with the idea of going outside, and it's now a thing for those of us who have a little box somewhere. We can always fly ourselves out and get whatever kind of treatment, because this is what our leaders are doing, and we also don't want to, in quotes, die at the hands of the doctors in the hospital, not because they're bad doctors, but because you can't tell whether the fuel or diesel will finish in the generator halfway through whatever you're experiencing. How do we as a people, because whether we like it or not, it affects all of us, how do we as a people, because we're in an agenda setting mode, make sure that we hold our leaders to account in terms of our health care delivery systems? Because if it doesn't bother them, then they don't care. How do we make it bother them? I mean, you're the health person, I'm not. How do we make them, get interested?
Actually, that ball comes back to your court. Because what bothers them is what people are saying about them, and how do they get to know? It's the media. So the people have to say it and keep saying it, and the media has to keep making it front page. That, oh, this one went abroad for blah, blah, this is not good. And the people have to keep commenting, this is not right. And when everybody is saying that, it really bothers them, because they need the public image to even win the elections. So we have to make it look bad and make them remember that we know what they did, and we think it's a very bad thing. And if we keep it up like that, I think it will become shameful for them.
Let's look at some of the interviews that the now Minister of Health has been granting. They've been talking shop about how they're going to do this and that in the health sector. What exactly have you seen as changes or any improvements since the Tinubu administration came on board and the Honorable Minister for Health? Have they been matching words with action?
Well, there are a lot of things being done on the public health front, I must say, which is your general, international health and public health, epidemiology, and all of that. A lot of things have been done, preventive medicine, but those things will take a bit of time to take root, and for you to see real tangible changes in our health statistics. But the low-hanging things, or let me say the things that are more obvious to the people, are not yet there. And I can see that, there's a huge challenge with the human resource thing. And I always say to people, you have to deal with that first, because the equipment and all that won't work themselves. So you need the right people. If you build or you equip the best, your general hospital, best equipment, but there are no people. The nurses are gone, the physiotherapist is gone, the doctor is gone, then the equipment is also going to sit there. and the service will not be there, despite the equipment being there. So we have to tackle that, and we have to tackle it the right way. It's not a case of forcing the camel to the river, which I think is the approach we're taking at the moment. Don't let them get their reference letters and things from the council. I think that's a wrong approach.
Yeah. I mean, the Senate president last year said that the reason why Nigerians are leaving the country for greener pastures is because we don't have love for the country. How much of love would keep you in a sector that's gradually collapsing?
Well, I think the problem is that love doesn't seem to buy tomatoes and doesn't please any landlord. When the doctor, the nurse says, I love my country, that's why I'm here, but Oga landlord, I can't pay the rent. The landlord doesn't seem to care about that love, and that's when people have to do something about their lives. They have to find how they can pay. And of course, it's even more difficult for the healthcare worker because of the kind of job they do. And to think that, look, I do all this work and here I am, I can't afford the basics. So it's tough. It's not about love for the country. If anything, I think if you're looking for people who love the country, that's where you should start from. Because there are people who walk around the clock. I know the kind of schedules when I worked in the general hospital, the kind of schedules we ran, it was crazy, and despite that, you're just looking for a reason to penalize a nurse or a doctor or whatever, which I thought was ridiculous.
I've seen a couple of hospital movies, and I really don't envy you guys. And I've also heard lots of people say, well, in today's Nigeria, just pray that you are not sick, do your exercises, take your medications, try to avoid the hospital because that just might be death waiting for you. How do we change that narrative? Because really, people are no longer going to hospitals. They're so afraid to go to hospitals now because they don't even trust. They're feeling like, oh, the best hands have all left the country. There's brain drain. So the people that are there are just there because they don't have any options. How do we change that narrative?
Well, the narrative exists and has existed for a while. And the truth of the matter is that there are very good people around in the hospitals that we have. They might be overwhelmed because of the numbers of people that have left. So even your very good person who used to attend to 10 people, 20 people, as a specialist a day, now has to deal with 50. That also is a challenge in itself. But again, out of the compassion, he's trying to find a way to handle the 50. But they're very good people. In fact, I was still talking to a friend who runs a practice in Canada, and he was telling me how one of the hospitals gave a patient a list of doctors in Nigeria that they could go see. That when you get back to Nigeria, these are doctors we know that can take care of you. They can continue the care. They are very good. They are experts like us, and they can handle your case. He said he was impressed. They gave about 5 names there and said, go see these people if you need anything. So there are good people there. I think, in fact, the challenge we have now is that, again, because of survival, many hospitals are coming into place with great service. In fact, services, equipment, everything that will match what you get abroad.
But then you can't pay.
Or you can't pay. They're very expensive. So it's the same thing that's happened in the education sector, where all our parents or grandparents went to public primary schools, and then we got to a stage where we couldn't attend those schools. Any child you had to go to a private school. Primary school, whether it was one block, one bungalow, it had to be private because the public was nothing to write home about. And then that moved up to the secondary school level.
Yeah.
And then, so those who went to private primary school could go to public secondary school. But then after a while, they couldn't. You have to look for a private secondary school as well. Now it's come to the university level.
We have to go on a break, Doctor. When we come back, Dr. Doyin Odubanjo is with us in the studio, and we're trying to set an agenda for the medical sector in 2025. Stay with us. We'll be right back.
You are listening to your number one station for talk.
99.3 Nigeria Info.
99.3 Nigeria Info. Let's talk.
Hey, BC. It's school season again, oh. The price hike in the market, eh?
Right? That's why my budget is tight this year.
I'm only here to shop a few things, Jerry. See you later.
It looks like you decided to splurge a little.
See, thanks to Skit, the prices were less than I calculated. Since I had some money left, why not treat myself too?
Wow, same here.
Get your school supplies for less at Skit Store. Visit our stores in Lagos, Abuja, and Port Harcourt, or shop online at www.skit.ng. For inquiries, please call 0807 728 5058.
This year, Chocolat Royale proudly celebrates 30 years of creating delicious memories and crafting memorable experiences. We are proud to be serving exceptional gourmet foods alongside your favorite desserts. From intimate gatherings to grand celebrations, it has been our honor to bring people together with flavors and moments that last a lifetime. To our cherished clients, partners, and team members, thank you for being part of our journey. Your trust, loyalty, and support have allowed us to grow, innovate, and continue doing what we love. Here's to 3 decades of creating delicious memories and many more to come. Thank you for making it all possible.
Auntie, you are enjoying, oh, only you. Peppered rice, amala, nkwobi, masa, cake, and now ice cream. I hope you have Justifies on you.
Justifies? I never leave home without it.
That's right, Justifies, the new natural effervescent powder for an instant refreshing relief from heartburn and stomach indigestion. Just add Justifies into a cup of water, drink, and you're good to go. Justifies, your relief on the go. Justifies is from the House of Gestede. If symptoms persist after 3 days, consult your doctor. Made and marketed by Ranbaxy Nigeria Limited, a Sun Pharma company.
Attention travelers, pack your bags. ValueJet now flies from Lagos to Owerri and Owerri to Lagos twice a week. Enjoy a great mix of modern convenience, affordable fares, and hassle-free travel on every flight. Whatever your reason for travel, ValueJet gets you there in style and comfort. To book your flights, visit our website at www.flyvaluejet.com or download our mobile app on Google Play Store or App Store.
ValueJet, wings for everyone.
Harude, my young baby, Harude.
Hey, whoa, Mama, it's not Harude now. It's all day deodorant.
Hapumo, leave me and my Harude, I beg. Because is it because you dash me perfume?
Mama, not be perfume now. It's deodorant.
Eh, now roll on they talk now. See they make me scent well. Harude.
All day, Mama, all day.
Whether na market or even church self, I go wear up. Harude. I know they fear sweat again. No.
All day.
Oh my little. Now wait till you save the way go that your office now, eh? When you came,
Mama, now all day shoppers.
Whether na all day, Harude, as long as you dey buy up, I go dey use.
Mama, you never change.
All Day Antiperspirant and Deodorant has you covered all day, whether it's market runs or office calls. Smell sweet, feel fresh and confident. Do it for you. All Day Antiperspirant and Deodorant, now available in stores near you.
Success is like an aeroplane. You only see the graceful flight high up in the sky, but not the roaring, powerful engines propelling it. Likewise, in the world of e-payments, you only see transactions done, funds remitted. But who pioneered these financial technology solutions? Well, you knew it as ValueCard, now Unified Payments, Nigeria's premier financial technology service provider. Yes, it starts here. Find out more at www.up-ng.com. Unified Payments, innovations that work for you. Stay sharp, fuel up, and be on top of your game. Power Horse is here to boost your energy and conquer the day. Don't miss out on an unstoppable offer for Niger. You can now buy Power Horse 250 ml for just 999 naira. And for those who need a little extra, grab the 355 ml for only 1,299 naira. Don't wait. Head to the nearest store today and fuel up. Power Horse, unstoppable you.
Millions of listeners trust us on Hard Facts. Whether it's politics, social issues, controversies, and trending stories, you know we're credible and objective.
It's Hard Facts with Maryann Okon on 99.3 Nigeria Info. This is Hard Facts.
30 minutes gone past the 5 o'clock hour. This is still the nation's #1 talk news and sports radio station. The program is Hard Facts. I am Maryann Okon. I still have Dr. Doyin Odubanjo here with us via Zoom, and we're talking about the health care or the health sector generally. Is there anything being done to revive it, to fix it, and what do we need to do so that government can pay attention, prioritize, make it front and center? Now they're telling us that at the borders, they're checking all travelers because of some new virus from China. Maybe Project Fear is what is going to help us. Maybe the doctors need to take advantage of this Project Fear to fix the infrastructure in the hospitals. Doctor, what do you think?
Well, yeah, I think there was an element of that in 2014 with Ebola, and the health sector took advantage of that. It was repeated in 2020. The health sector got some benefits, but not enough and not sustained, as it were. So maybe having another scare might help us to realize, especially that we haven't done what we should have done, coming out of the COVID scare. We didn't quite sustainably do the things we needed to do for the sector. Right, for instance, in the middle of that COVID thing, when the skies were shut, a plane was actually chartered, brought to Nigeria to carry doctors away. And that just tells you how seriously some others take it and how we take it. So we since then should have sat down, had a real proper, conversation with the stakeholders, with a good, maybe even neutral arbiter to discuss properly what should be done, for the human resources, what should be done for the facilities, blah, blah. Of course, we know government has limited resources, but there are certain things that you can do. Some may not even take the resources you expect, for instance, from government to get them done. But we will know them if we have a neutral platform for that kind of conversation.
What neutral platform are we talking about, and how?
Well, for instance, I can tell you that many years ago, I did hear from the president of the Nigerian Medical Association then say that a body like the Nigerian Academy of Science can convene a meeting of all the stakeholders. And he said if the Nigerian Academy of Science did it, they would cooperate fully. He said if it was the government, they would not trust government. So those are the kind of things I'm saying. When you say, government says, let's do this. We've had, for instance, what do they call them? National, this thing, confab or whatever it is about our constitution. We've had about 2. What happened to them?
We're about to have a youth confab, by the way.
So we keep having these confabs, but what happens to them? And in fact, what did anybody see the report? Were those reports doctored? Now those are the things they are talking about. The fact that if it's just government, we won't trust what comes out of it. But if it's not, it's a respected body, that is managing it, the process, the conversation. We will trust it. We will trust that nobody will doctor the report. We will trust that whatever recommendations are made will be just as agreed on, and it's not left to the stakeholders to implement accordingly. But where you can't even trust, we don't even trust some of the bills that are passed. Because the bill is passed and somebody tells you it was changed. Actually, the copy that was passed is different from what they discussed. So
I'm thinking about the average Nigerian. What do we do in the interim while we try? Because it looks like the government is still trying to figure out what they want to prioritize most, when that should be health and security. How many more of us have to die? Let's not even talk about pensioners. The generals are getting a nice sum amount. There are some people who have left that army, who fought in wars and still have not received their pensions. So I'm looking at everything that I've been discussing since we started this year, and it feels like everything needs attention, but none of it is getting attention. Where does the average Nigerian look to for help if even the healthcare sector is somewhat abandoned? Only lip service is being paid to it.
Well, the average Nigerian needs to speak out more. People say, we're tired of talking. I say, no, you never get tired of talking. You have to keep saying it and saying it and saying it. First, once it becomes a chorus, it's loud enough for everybody to hear you. No matter who they are, no matter where they sit, no matter how secluded their office is, they're likely to hear you. And that way you dictate the agenda. Of what's important. They realize, what, this is really important to the people. We need to do something about it. And they'll start taking certain steps about it. So I think we need to do that. We need to keep talking more and more and more, because again, it's something that's affecting everybody. It's affecting all of us, whether we like it or not. I keep joking with people. I say, the more people call me and discuss their medical situation and tell me they went to a hospital, I find myself asking questions. And one of my first questions these days, and in fact for the past few years, is I say, did you see a doctor? And they go, yeah. I say, a real doctor. And I say, how do you know? Because once you start having the genuine missing, the quack takes over. Because
WebMD. You know me, I always go to WebMD first.
Well, if I'm a quack, I would also look at WebMD. I would look at Google to give you some answers. So I probably would match what you read, and might impress you even more because I'm saying it almost word for word. So I might impress you more. But there's something about the practice, as you call it, the experience gained. It's also a problem. Years ago, I had a chairman of a hospital board saying, yeah, they are going, let them go. Nurses were leaving, let them go. Said, how many nurses are graduating every year? And I thought, so does he think that one is the same as the one with 10 years experience?
Of course, it would take 10 more years for the person to get as good as the other.
Exactly. So, but as far as it's concerned, you are graduating so many every year. So let them go now, And I thought, no, my God, what's wrong with us? Why do we think this way? So we can, and if we make noise about it, if people went to a hospital and you saw the facilities and they're not up to par, the place is all run down and dirty, why don't you talk about it? Let people know that, look, my general hospital is just like a slaughterhouse. It's dirty. Actually, I wouldn't say the hospital, but I did go to a public hospital some years ago. And I got to the emergency room. I could see blood stains on the wall and whatnot. And I'm not talking about blood stains of this morning that somebody hasn't cleaned. I'm talking of stains that you can tell have been there for a few days, if not weeks. So I told somebody jokingly, I said, if I was sick and you brought me in here, I would die.
I will run away.
I would just die. Because as far as I'm concerned, this is a slaughterhouse. Nothing good can happen here. So we need to talk about some of those things.
Okay, I want us to talk. I want to open up the phone line. So, Lagos, join the conversation. If you're listening to us from outside of the country, you can join us via Skype. We're Nigeria Info FM. We're also live Facebook and on YouTube, Nigeria Info. Post your comments, your questions. Doctor is here to answer them. 0201-277-0993. That's the number for you to call. If you're male, the female, 0201-465-7190. Can we save the health sector in Nigeria? Are our governments prioritizing the health of every single Nigerian aside from theirs and their cronies? Let's talk, Lagos. 60 seconds is all you have. Hello.
Hello, good evening.
Good evening. What's your name? Where are you calling from?
Emmanuel from Lagos.
Go ahead.
I think one of the problems of the health sector in Nigeria is that the government doesn't value doctors and the health workers in general. Well, we are one of the worst paid in Nigeria. I mean, the world, rather, I say Nigeria. The worst paid. For instance, some doctors, low-cadre doctors, their entry level, as of 2018, they earned about $750. Now they don't even earn $200. You know, many of the doctors are poor, and you don't expect them to leave. They will leave, and more will leave. The nurses earn less than 170,000 naira in Nigeria. And you don't want them to leave. They will leave. They will all leave. And that's the problem. The government and the politicians, they go out for medical tourism, so they are not affected. It's the majority of the poor citizens that are affected. When you say, and we have many doctors, the experienced ones leave, and you leave the fresh doctors who know close to nothing. It's like building on a very faulty foundation.
Yeah.
So I believe our government are not ready. When they are ready, they will know what they are doing. But doctors keep living, and they will keep living.
Okay, thank you for calling. When are they going to be ready? Can we make them ready? Because I also don't like that attitude of, they're not ready now. When are they going to be ready? When? What year? Hello? Sorry about that. Do call me back if that was you. Hello, welcome to Hard Facts.
Good evening.
Good evening. What's your name? Where are you calling from?
Bola is my name, calling from Alagbole.
Go ahead, Bola.
I want to sincerely thank the doctor that you brought to the program today. But to face the reality, we need to take responsibility for our health. Health is not cheap anywhere in the world. We take testing of these medical tests, we take it for granted. That routine check that each and every one of us ought to be going to. So go and do. We are neglecting it. At every time I have money, I make sure that I go to all of these beautiful test centers, at least to do a routine check. From there, you've been able to discover so many things that will have knocked me down. All of this, and by the time they say they cannot afford all of these services that you are saying, the service is not cheap, the services are not cheap, when they want to go to party, you see the same people throwing money on the floor. Buying Ashwebi, buying Ankara. I'm bad. To come and deceive ourselves that the cost of medication is very high. They say if you say the cost of education is high, try ignorance.
Okay.
Let them see the other side.
Thank you for calling. Great point that he's made, Doctor. Do you want to add?
He's raised a very good point, which is that if things are bad, or let's say the worse things get, the more you need to pay attention to prevention, because that's way cheaper. So you don't want to be rushed to a hospital on an emergency basis. That's going to cost you an arm and a foot. So it's like even the regular stuff, a lady who's planned for, if you're going to deliver normally or you have a routine CS, it's cheaper than running into an emergency cesarean section. So you don't want things to be an emergency. You want to prevent them as much as possible, right lifestyle to start with, as much as you can, and then do your, recommended tests and checkups and all of that. Do them as much as you can. It's way better and cheaper for you than if you had to be rushed in for something. And if you had to be rushed in, only God also knows where they are rushing you to. It might not be the kind of place you should be in. So
I can't get off. I can't get that picture of blood stain in the emergency room off my. I can't take it out of my head now because. Oh wow. Hello.
You could tell. They also, apart from cleaning, needed painting. You could tell they haven't painted in donkey years and whatnot.
Hello, welcome to Hard Facts.
Yeah, good evening, Maryann.
Good evening. What's your name, sir? Where are you calling from?
Romeo from Ejigo.
Hi, Romeo.
Good evening to the doctor also.
Good
Just
evening.
like the truth of the matter is this. Really, nothing comes easy. But if the government could, like, let's say, okay, subsidize even this health sector, just like the money they are giving to generals to go for extra coach, pick a 20 that drop it in our health sector. Things will be a little bit easy for people. Okay, people really, someone that wants to go and take care of himself, that does not even, they've not been paid salary. How would that person take that? It happened to me when I was in Tobago, Jinone. I went to the Ono Medical Center. The doctor on duty there had to come from our own personal hospital, and I had to transfer her back to our hospital to be taken care of. Because the facilities are not there in the Ono Medical Center. And she has it in her own clinic. So there are things that are going on that are very wrong in this country. So we pray that the government also will at least make things easy for people to put more importance to their health.
Okay. All right.
Thank you.
I don't know if subsidizing healthcare is the solution. I mean, healthcare delivery is expensive. Let's not even start with the US. It's worse. I mean, with what you have in the UK is at least manageable. It's still not great, but it's better. But what I would advocate for is fix it up, make it up and running to standard. People can pay. And then, of course, you can subsidize for the primary health care, the health posts in different local governments with, the bare minimum.
When we're talking government, is that any government provided care is usually subsidized. It ends up being subsidized. So we're saying government should provide the health care, fix up the system. Why? Because that's subsidized at the end of the day, compared to if you went private. So we're all beginning to see, like I said, the hospitals that have everything you want, but they can't afford them. Very few Nigerians can afford them. They can do whatever surgery you want. They have the machines, they have this, they have that. They fly in experts sometimes from the US, from wherever to come and do it. They bring some from your general hospital, from your teaching hospital in Nigeria to come and do it, but they have the equipment. There's none in the teaching hospital. So the guy comes here to do it for you in this five-star hotel hospital. And he also gets a handsome pay for what he does, but he's available in the teaching hospital or the general hospital to do the same, but he can't do it because he's not equipped to do it there. So what you then go, you end up going to the private care and you pay through your nose. But that same expert is there in the public hospital, he's underutilized. But he could do the same things for way cheaper than what you pay in the private care. So government care usually almost always will end up cheaper. And that's why government is important. So health sector education, important areas where you don't want government stepping out of it. You want government to perform very well there. Otherwise, the private sector takes over and it comes out of reach, or it goes beyond the reach of most of your citizens.
Let's take a few more calls. Hello, welcome to Hard Facts.
Hello, Maryann.
Good evening.
Good evening. You're doing a good job. Emeka is from Sunlight.
Thank you, Emeka. Go ahead, please.
Greetings to the doctor in the studio.
Good evening.
When we speak of government, we have three arms of government. And that is why I always blame the legislature. These are the people's representatives. These are the people who are supposed to put the executive arm on their toes. But it is safe to say that the legislature has failed this country. Our representatives, both from state to national level, are just busy. I don't know what they're doing in that house. Sometimes I ask, this bicameral that we operate, how useful has it been to us? These institutions are talking about the medical field or sector is as critical as a country's economic development. Our doctors, wherever they go all over the world, they are top-notch. From the US to Dubai to Kuwait to anywhere to France. Most of the places I've been to, you see our doctors excelling. But here in this country, because of the decrepit institutions, they're not they are underutilized, and you find them living in droves.
Yeah.
Until we come up with some form of piece of legislation that will create an embargo on politicians accessing medical care outside, they will never give attention to what we have in this country.
All right. Thank you, Emeka, for calling. I appreciate you. I'm letting you go because of time. I have 4 minutes on the clock. I want to read some messages coming in on WhatsApp. Let's go to WhatsApp and read your messages. Let's see. This one here says, your guest said that the government have little resources. I don't think that statement is correct. Or I would want him to explain what he meant by that if I'm wrong, because even the blind can see how wasteful our governments are on things that concern them. Taiwo from Ijibu.
Okay, quick one.
Okay, go ahead. Go ahead.
Limited, not little, but limited. Meaning if you were to take care of everything you want to take care of, you don't have endless resources. You know, so you will have to, at some point, how much would you give to security? How much would you put to this?
So you prioritize.
Prioritize. So I agree with you. There's a lot of wastefulness. So we can still do more. I always tell people that. I say, you can't convince me that there is no more right now to give, because I can see where you are wasting a lot of money. You know.
Okay, let's go read some more messages. I have about 3 minutes on the clock. Kaya Dave from Ikotu says, quite a pity that those who rendered selfless service to this country suffered the most. I'm retired as a teacher over 31 years. I paid my subscription for national health insurance, but had never enjoyed any medical service. In fact, I was operated on my eyes over 5 times in a private hospital, self-sponsored. I paid subscription for National Housing Fund, yet never collected a single house. Yet all subscriptions yet to be refunded after over 2 years ago that I retired. The worst policy and program is the pension scheme. And he says there is God. And doctor, this brings me to, this whole medical insurance. A lot more people who enjoy medical insurance are the people who work for private companies. The public service, what do they call it? NHS or NHIS.
NHIS.
How does that? I'm sorry, I'm at a loss. We have just 1 minute, doctor. What can you say about the NHIS?
Well, it's work in progress. Let's put it that way, and let's hope that it gets there. As you read that message, I was laughing because we had our first child, and my wife worked in a teaching hospital, and we were subscribed to the NHIS, but we had to buy every drug. So she was staff, but we still couldn't get the service required as at then. So as I was laughing when you were reading that. So not to talk of somebody who is not staff, who comes from outside to say, I have NHIS. But it's work in progress, and it's essential work because, like you pointed out earlier, healthcare is expensive. When you look at the real cost of providing healthcare, it's very expensive, and it's probably unaffordable to the generality of people worldwide, actually. So the only way you can escape and get good health care is by health insurance. The insurance principle of expecting that most of us will not have major illnesses in our lifetime, but the few that would be well taken care of because all of us are putting money into a pool. So we have to make it work sometime or the other. Health insurance has to work for us.
I don't think I've had a sad conversation this year as this. This is my saddest conversation. It makes me leave.
That's a shame. That breaks my heart. So
it's not about you, doctor. It's just about how bad the situation of things are, and I feel really terrible. But here's to hoping that things change in the coming years. Hopefully, it starts in 2025.
They have to. Things have to.
Dr. Doyin Odubanjo.
The good truth is that, they say when you eat that is down, need fear no fall. So the only way now is up, isn't it?
Okay. Well, Dr. Doyin Odubanjo is a public health physician. He's also a scientist. He's a part of the Nigerian Association of... How's it called?
Academy of Science.
The Academy of Science. Yes, he is part of the Academy of Science. Thank you so much, Doc, for coming. We have to go.
Thank you for having me.
All right. Well, Lagos, we've got to go. Follow me on Twitter, Instagram, Threads, MIMIEYO, or you just search for Maryann Okon. We'll be back tomorrow. And we're going to be talking about the landmark demolitions and what the landmark guy had to say about it and several other issues. Of course, the Canadian Prime Minister stepping down and every other thing in politics. My name is Maryann Okon. I love you, Lagos. See you tomorrow.
More conversation, more talk, more right after this.
.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's